Hello everyone. Today's video is another Q&A video talking today about disulfiram being used to treat Lyme and co-infections, palmitoyl and also about secretory IgA as possibly being a marker of mold toxicity in the gut. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the first question here is, can you do a video on disulfiram for Lyme and co-infections? So a little bit of background. Disulfiram is a pharmaceutical drug. The other name for it is antabuse, and it was originally developed as a anti-alcoholism drug, because if you're taking this medication and you have even a little tiny bit of alcohol, it will cause you to feel really, really sick and basically vomit your guts out, and it really acts as a negative reinforcement tool to stop drinking alcohol. Now, of course, you have to take the drug in order for it to work. So if folks, don't take the drug, then they can just go back to drinking again. But anyways, that's the background on disulfiram. So a number of years ago, I can't remember how many years ago, but someone did a study where they took a look at all these different pharmaceutical drugs to see if any of them might work to help kill different microbes, including Borrelia. And they found that disulfiram actually worked really well for some strange reason. So that led to some clinicians using disulfiram as an off-label off-label treatment for Lyme, and it can be really, really, really effective. Unfortunately, it can also lead to a lot of neuropathy side effects. So some folks have just really debilitating neuropathy symptoms, and that can make it really, really challenging to stay on the treatment. So I've only had a few patients who have been on disulfiram. It's not in my scope of practice to prescribe pharmaceutical drugs here in beautiful Nova Scotia, Canada. So I don't have any direct experience prescribing that, but just I've had a few patients that were prescribed disulfiram by their medical doctors or naturopathic doctors in other provinces or states, and it did seem to be really helpful. It seemed to move the needle more than other treatments did, but then the side effect profile precluded them from continuing with the treatment. So I do think it's a strong treatment, but just, yeah, it's that darn side effect profile that seems to be kind of the rate limiting step. So I think it's a great treatment in many respects, but just not sustainable for everyone. Now, my understanding of it by proxy is that like what I've heard from other clinicians, is that some patients seem to tolerate it really well, and if they have the right supports in place, like the right anti-neuropathy supports in place, then sometimes they'll tolerate it just fine. So I think it's certainly a treatment that I would consider prescribing to my patients if I had it within my scope of practice, but really, really hard to get access to that in this part of the world. So anyways, any other questions on that, feel free to post in the comment section, but I'll leave that part there for now. The next question here was about palmitoyl, also known as PEA. So I had mentioned it in another video. I'm assuming it was something about histamine intolerance or mast cell activation, because PEA seems to have some mast cell stabilizing effects. So it says, I was reading about how PEA is good for pain reduction, but then I looked at the ingredients and I'm confused because it looks like it's basically vegetable oil. I avoid all vegetable and seed oils and was wondering if PEA is essentially veggie oil, or is it a purified super healthy extract that actually does help with health? So yeah, great question. So I've recommended PEA to quite a few patients over the course of time, and I haven't seen any adverse effects from it. I'm sure that now that I've said that, that's probably jinxed it, and somebody is, down the road going to flare for PEA after I prescribe it. But generally, it's been really, really well tolerated, and I also, avoid seed oils vast majority of the time, as much as I can. I think it's probably better to keep those to a minimum in one's diet. And so I'm like right there with you in that, like, I have concerns about that too. Just like, my my go-to phospholipid supplement that I recommend is from the company Body Bio, and it's derived from soy, and it's like generally, like, I keep soy to more of a minimum in my life and don't really recommend it to my patients by and large, but there's certain soy-based products such as the Body Bio PC product, or there's a soy isoflavone called genistein, which is something that can be an important part of an oncology protocol for some patients. So there can be good things derived from things that maybe in other forms and other contexts are maybe not so good. So I think PEA is one of them, but generally I've seen it be well tolerated. Unfortunately, it doesn't help everyone. Like, it's not a panacea, but I would say depending on the case, depending on the indication, it's got maybe a 30 to 50% success rate. So not knocking out of the park high, but it's something that can be a useful adjunct. And sometimes when we're trying to bring some symptom relief into the mix, whether it's around the pain management, whether it's around the mast cell stabilization, those would be the main reasons I use PEA. I don't know if there's any others that I would typically use it for. Then yeah, it can be worth trying. And sometimes it knocks it out of the park, and then sometimes it's just mildly helpful, and sometimes it doesn't help at all. But it can be worth trying. Last question here is, it says, would you say a very high secretory IgA in a stool test could be indicative of mold toxicity? I theorize this could be the body trying to deal with mycotoxin overload in the intestines. I have all the symptoms of mold toxicity, just wondering if you have seen this secretory IgA raised in other mold patients. So it's a really great question. To be honest, I have really not paid attention to that. The only times we run secretory IgAs are when they're part of larger stool profiles that we're typically running in patients with digestive issues. Now, a lot of my patients with mold issues have digestive issues, so we do run stool testing in them as well. But I haven't noticed that in particular, but I thought it'd be worth commenting in video format here on this, because I think it's a really interesting idea. I have done a deep dive into the research literature on secretory IgA up to, because I put together a course for other clinicians on digestive tract lab tests, or lab tests that relate to the digestive tract would be a better way of putting that. And I did that maybe 4 or 5 years ago. I can't remember now. So I was right into the research up to that point. So there might be something new out there since then that I haven't looked at with respect to secretory IgA. But up to that point, anyways, it was interesting because it seemed to indicate either that there was if there is a elevated secretory IgA, that could be indicative of there being a microbial overgrowth in the gut, meaning that the immune system is like ramping up defenses, trying to kill off the yeast or the bacteria, whatever it is that's overgrowing. But also low secretory IgA can mean the same thing, because the immune system is beleaguered and is going to make it easier for the microbes to overgrow. So like it's a little bit of a, like if it's high, it means an overgrowth. If it's low, it means an overgrowth. So that seems like conflicting, or seems questionable utility, which is part of the reason why I don't put a ton of stock into, maybe not I don't put a ton of stock into secretory IgA, but I don't, the secretory IgA comes alongside a larger panel that we run. And so I don't go out of my way just to get a secretory IgA, because I think it's of limited benefit. That being said, I think it's entirely plausible that if there's elevated mycotoxins being secreted into the intestinal tract, that could potentially raise a secretory IgA. Now, I think the question mark would kind of arise, if someone had really gummed up detox pathways and they weren't able to effectively metabolize those mycotoxins and excrete them into the intestines, then if they never get there in the first place, they're not going to cause an irritation, and so we wouldn't see an elevated secretory IgA as a sort of downstream marker of there being mycotoxin elevation. So I think it's something that might correlate with it, but I think there could be some patients who have like crazy high amounts of mycotoxins and their secretory IgA is totally fine because they're not actually hitting the large intestine in the first place. So I feel like there's, I guess I question the amount of utility of that type of test. So it's a really interesting question, but I'm really honestly not sure if it's, I'm not sure how clinically valuable it would be, but anyways, appreciate the opportunity for this thought experiment. I will leave it there for now. If anybody has any questions or comments on these topics or anything else, just post in the comment section below. I'll do my best to answer as soon as I can. And if you wouldn't mind taking a quick moment to please like, share, subscribe, and post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that.